2019, not 16.
Yeah.
So it wasn't until October of that same year that I got a definitive diagnosis.
Mm.
I had gone through, done a lot of tests, physical, all types of tests. Unfortunately, it's not something that you can, draw blood and go to and get it looked at. So
Yeah.
it was until October 2019 that I got diagnosed.
Wow. Doctor, what causes this disease? What are the causes of this disease?
Well, the truth is that there's no known cause. mm. But what usually happens is that some people have a familial predisposition, that's family history of having it. Then, when there's a combination of some having other triggers, such as having a viral infection or maybe having other chronic diseases like an
Mm.
autoimmune disease, like SLE, start systemic lupus erythematosus, rheumatoid arthritis, osteoarthritis, diabetes, or maybe being having stress, which could be emotional stress or post-traumatic stress. Either the person had had an accident and after some time starts having post-traumatic disorder,
Mm.
or so there are just a lot of risk factors that could cause it. We mentioned obesity, diabetes, and other chronic. And also being a female, funny enough, being a female predisposes you because females are
Wow.
more common, as it's more common in females, about 2 to 3 times more than males,
Wow.
actually. Yes.
Wow.
So
Like
those
it
are
wasn't
some
hard
of the
enough being
things
a woman.
I'm telling you.
Like it wasn't hard enough being a woman. But what are usually the
As in,
signs? What are the first signs, and how does a person get it? Like what are the first signs? How would you first know um like what Ijeoma said. Ijeoma said she was feeling pains all over. Do you start with
Yes.
pains first or
Yeah, well, the thing is, it's the common symptoms the person could present with initially could be widespread pain. So the person has pain all over the body, the muscles are aching, the bones are aching. So it's widespread. It's on the right side, it's on the left side, it's above, it's below. So and those that pain is in that same intensity or even worsening intensity for over 3 months. So that's why I said it's a chronic
yeah.
disorder. So it must last for at least 3 months. Then also the person has extreme fatigue. Person goes has difficulty sleeping or wakes up feeling unrefreshed. Then the person could also have pain, low pain threshold. So person has pain, heightened pain to usual pain, or person could also present with pain to things that are not usually painful. Like if you touch the person instead of feeling like a light touch, will feel it as pain, you know. And also the person could have depression, feel depressed, have anxiety disorders, have tingling sensations around the body. So it has a lot of symptoms it could present with, but these are the common ones the person could have. Headaches as well. So these are the common ones the patient will present with initially.
Ijeoma, on your journey to being diagnosed with this disease, how was it like? Like you said, you weren't able, it's not a situation where you can draw blood and take to a lab to get tested for. So how was it like, with the healthcare system here in Nigeria before you got diagnosed?
Well, I of course once you are in Nigeria, you know that certain things will just become par for the course, and probably like the first 3, 4, 5 months, I'm not sure that the doctors, apart from my regular doctor, Dr. Kujimi, who was a great help. Most of the other doctors that I saw, at a point they kind of were like, okay, why is this thing not going, and why is it that um, no matter what we do to treat it, the pain is all over. So it's not something you can say, oh, my knee is hurting, or you say, okay, my back is hurting. You actually literally have pain in every single part of your body. So if it's not something that you maybe have knowledge about, or maybe have any kind of experience about, you get to the point where you just feel as if people are now like, okay, is this thing really a thing? Is this thing, whatever it is that is worrying this woman, is it actually, or is just something? I was even told, a couple of doctors told me it was in my imagination, it was in my mind, you know. But I had a friend who also happened to be a doctor, And I had been telling her my symptoms for a while. And then at a point, she just thought, okay, she called me and said, the symptoms you've been talking about seem to sound like something I know. Then she sent me to a rheumatologist. And that was why when I finally got my diagnosis. And it's that thing of like, okay, finally someone says it's real. Finally,
Mm.
someone accepts that this thing is a thing. This thing has a name. It's not just my brain, you know, trying to mess with me or something.
Mm. And I mean, coping with it now in Nigeria, just the fact that it's sad, and I hate to say that this is our reality, but honestly, unfortunately, it is true. Many of our buildings are not what you would say handicapped, handicapable for handicapped, where they're able to access so many things. The buses are not the same, the buildings are not the same, there are not many wheelchair parking spaces for handicapped. But how have you been able to cope after just living in Nigeria with this?
Yeah, actually, a few weeks ago, I spoke about it online because it's actually something that is almost like people with disabilities are invincible. They are not there
Mm,
because the buildings, the roads. I currently use a cane, but some fibromyalgia patients have to use a wheelchair,
mm,
just to even get around. Some have motorized wheelchairs, some have regular wheelchairs. But you just get to a building. There's no way, there's no way that this person is going to come down,
coming, yeah,
walk the steps, and then get to wherever. And then you see some buildings, they'll build three,
stories
3 levels, yeah, 3 stories, and then 4 stories, and there's no single, like, it's just assumed
that
that
you take the
everybody can
stairs.
climb the stairs, or it's assumed that even to get from the outside, if there's a lift inside, it's assumed that, oh, you should be able to pass these 3, 4 high stairs to get to where the lift is. So it almost feels like you are non-existent. Like, whoever built this didn't even cross the person's mind to
Mm,
make any concessions for someone who is disabled, or who doesn't have the ability to use their legs, or who isn't even, because what happens with fibromyalgia a lot of the time is that it's not even that you just don't even have the energy to, even if it's one story that you have
mm.
to, it's sometimes it's
Because
just
you're
like,
literally
no,
in
it's not
pain.
something that's possible. Exactly. You're literally just, and it can be frustrating sometimes because you are just feeling like, I'm a person, I exist here, and, I'm a productive member of society, you know, as it were, like everyone else. So how come I am being erased, basically?
Mm, mm. Doctor, before we go on a break, I'm going to come to you to talk about, whilst we're having this conversation, whilst I was planning for this interview, I remember speaking to Ijeoma, and she was telling me about how, how we're trying to get a doctor to come on to discuss with us. She was telling me a rheumatologist was unavailable because he had traveled out of the country. And before I was able to track you down, was literally, jumping through hurdles. And it got me thinking, why
Yeah.
are there not many specialists to treat this, this particular, in this particular special field of medicine? Why are there not so many in Nigeria?
Okay, well, the truth is that rheumatology is a relatively, you will say, relatively new. And even though, like I told you when we're planning for this, was that we have
Mm,
about 41 of us in the country currently, and that
wow.
includes trainees and consultants. And unfortunately, the brain drain is also happening because even
Mm,
amongst the 41 I mentioned, some of them have actually left the country for better shows. So
mm.
it's a relatively new one. And luckily, Lagos has about four to five of them.
Four.
Yes. So,
Yeah.
But
and
how many of these cases of people suffering from this particular disease? How many would you say we have in Nigeria? Because I was looking for the statistics to be able to back up this this interview, but I couldn't find so many.
Okay, the truth is, fibromyalgia is, you some consider it a rare thing because it affects, like I said, about 2 to 5% of the world population. But luckily, my part 2 thesis was on fibromyalgia. I worked on fibromyalgia, trying to find
Mm,
the prevalence in a certain population. I worked on fibromyalgia and rheumatoid arthritis patients. And out of the 75 patients I worked with, I was able to diagnose that in about 5% of the patients. And
mm,
you could see that
Wow.
even though they already had rheumatoid arthritis, with the fibromyalgia, they had worse disease activity. So they were in worse pain.
wow.
They had
Mm,
lower life,
Expected.
qualities.
Yeah.
They had a whole lot of things going on because the pain is, you're having pain from not just the rheumatoid arthritis, but you're also having pain from the fibromyalgia. So you see the patients, they have worse disease activities, they have worse quality of life,
mm,
So it's an uncharted area in, will I say that, in Nigeria. But there have been
Mm,
yeah.
studies actually, because I know of a rheumatologist that did a study in Ilori on fibromyalgia as well. Yes, and I know of somebody else that did a study in Shagamu. So
mm.
the studies are upcoming, really. Yes, so it's
Wow.
And
We're
possibly why
gonna.
you
if I
had
could just add
difficulties
to
with that.
that,
Yeah, Ijeoma, please go ahead.
I said, and if I could just add to that, the other thing also is that when you have fibromyalgia, it kind of opens you up to a host of other conditions because, of
Mm,
course, your immunity is not as good as should be, and then next thing you find you are getting something else, other things. I, for instance, I have less restless leg syndrome. I also have um, fatty liver disease, and it all came
after.
basically, connected to the fibromyalgia. Yes. So that's, you hardly find a fibromyalgia patient who just has just fibromyalgia. You probably hear them list like a litany of other conditions
Yes.
that they now have that's now, making even the fibromyalgia worse.
Wow. We're gonna take
Let
a break.
me
And
let me
yes,
Okay.
I'm gonna make you hold your thoughts there, please, because we
Okay,
have to go
okay.
on a short break. I have to pay the
All
bills.
right.
But when we come back on the other side, I'll take your thoughts, and also we go in depth into women being at risk, and also some of the symptoms that women should be looking out for. I hear something about trigger points, the 18 trigger points. I think that's what it is in my research. But stay with us. This is Smooth Health on the Drive. My name is Judith Atibi. My guests are Dr. Okeke, Florentina, and Ijeoma Ogwuegbu. I hope I got this correctly now. She's still laughing at me. Ogwuegbu, it's Ogwuegbu. Stay with us. We'll be back.
Oh,
Oh, we'll be back. Stay with us. I'm, I'm so sorry. Ogwuegbu, Ogwuegbu, Ogwuegbu. I have to practice. Oh,
you
I'm sorry.
have no head.
Forgive me.
Don't worry. Don't worry. Trust me. Trust me. I've had this name since childhood. So I've heard every possible variation.
It's the same with me. So my surname is Atibi. My surname is Atibi. I've had Alibi. I've had Atiba. I've had Alizi. I'm like, isn't I even who don't see the name? It's Atibi.
Really tell you, I was trying to look for your husband.
I,
I was writing at and then I was like, I had to come back to the mail, the conversation between me and look
I,
at your name properly
um,
before I went.
Some
oh,
names are difficult to pronounce anyways.
anyways, well, what do? We have to learn.
Yeah.
Yes. So,
All right, we're going in studio. Smooth 98.1. Love music, love life. My name is Judith Atibi. This is the Smooth Drive. We're inside of Smooth Health on the Drive today, and we're talking about a very, very, very interesting topic. It's all about raising awareness on I'm fibromyalgia.
Fibromyalgia.
Fibromyalgia. Fibromyalgia.
Fibromyalgia.
Fibromyalgia, that's what we're talking about. We're raising awareness about fibromyalgia and also chronic fatigue syndrome and many of the diseases that surround that. Joining me today is a rheumatologist. She's Dr. Okeke Florentina, and also writer, visual artist, and also a survivor of the disease, Ijeoma Ogwuegbu. 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 It's Ogwuegbu. It's Ogwuegbu. It's so good. You guys, please let's keep going. So Florentina, before the break, you were gonna add something to what Ijeoma was talking about in terms of the symptoms and how the patient's immune system sort of deteriorates over the years.
Yeah. What I was going to add was that, like I said, the symptoms it causes a whole lot of spectrum of symptoms. So the restless leg syndrome she was talking about is actually one of the symptoms that patients with fibromyalgia could have. So that's what I just wanted to say. So the symptoms are quite varied and manifest in different ways in different patients.
Speaking about things that are quite varied, while searching, I was just trying to prepare for this interview and kind of get, put myself in give myself some clarity as to what this disease is about. I saw something about 18 trigger points, or tell us a bit about
Tender
that.
points.
What is that?
Okay, usually what happens, there are different ways of diagnosing fibromyalgia. So when you're talking of the tender points now, you're talking of the 1990 diagnostic criteria. So what usually happens is that, like I said, when I was talking, I said that the patient usually has pain to stimuli that are not supposed to be painful, like a light touch. So those tender points we're talking about, there are about 18 of them. And what usually you do is you try to apply pressure using the thumb of the hand you apply pressure till it blanches, that's till it turns red. So the person will feel it as pain and not as pressure. So there are about 18 of them. So usually what happens is, if in those 18 points, the person has pain in about 11 out of the 18 points, then the person can be said to have fibromyalgia. But like I said, this is the old way of diagnosing it. So yes,
So
because
what is the
now
new way now?
Okay, well, the new way is actually using a constellation of symptoms and signs. So the person has pain, chronic pain that would have lasted over 3 months in those about 19 regions. Then person could also have other symptoms, such as we talked about the sleep disorder the person would have, talked about having some cognitive disorders such as forgetfulness, having difficulty learning new things. So usually those things are graded and they're all joined together. And depending on the score, you now determine if the person has fibromyalgia or not. So
Nice.
that's the issue, yes.
Now, you said you before the break, you talked earlier that women are most at risk for the disease
Yes.
more than
Yes.
men are. So in women, like what? And again, before that, Ijeoma also, made note of the fact that when she was having her symptoms and going to look for answers, a lot of people were telling her is in her head, or she was, just thinking about it. It's not really whatever it was at the time. But for women, what are some signs that women would look for, being at risk?
Okay. Well, the symptoms that a person would present with is that the person would have widespread pain, like Ijeoma has rightly said. The pain can present as aches, burning sensation, or stabbing pain around widespread, usually in different parts of the body. Affects the muscles, affects the bones. Then the person would have pain, heightened pain to normally painful stimuli. Then the person could also present with having pain to things that were not normally painful, like when you have a light touch or you apply pressure, the person feels it as pain. Then person could also have difficulty sleeping, or person sleeps, then wakes up and feels like the person didn't have enough sleep.
Sorry, to just add to that, I'm actually going through that right now.
Yeah.
My sleep pattern has been broken, so now I sleep during the day and stay awake at night. And
Mm,
there's so much you can try and do, but
yeah.
Try, try. I'm so sorry for that. But is this a lifelong disease? Is there any cure on the horizon?
Okay,
It's not cure.
I think I'll start by explaining what cure means and what management means basically.
Mm.
Cure means you take a drug, maybe you have like example of somebody that has malaria. You take anti-malaria and the symptoms disappear and you're okay,
Mm.
you know? So that's cure. The disease is gone. While when you say lifelong management, it's like somebody that has diabetes or hypertension, the person is on drugs. So you're taking those drugs and those drugs are controlling the disease. Do you understand the difference? So
Yes.
usually it's for fibromyalgia, it's lifelong, it's a chronic condition. So usually what you do is the person is on treatment for a long time.
Wow.
So that's the distance. So it's not something that is curable, but it's something that is manageable with using drugs and non and other things that don't involve taking drugs like exercises, doing acupuncture. You know, I've had patients that say acupuncture works very well with them. But basically you have to explain to the patient. The patient has to, the first thing is actually making that diagnosis. Because like Ijeoma said, she's been to various hospitals, she's done a barrage of tests before they eventually said it, kept saying it was in her head. So the first and most important thing is actually making that diagnosis. Then after that diagnosis has been made, you need to educate the person about what this disease is all about and different ways to cope with the disease. You understand? Because it's
Mm.
one thing to understand what is happening with your body. I think if you know what is happening with your body, helps you to cope better.
Mm-hmm.
So you need to educate the patients. This is what is happening. This is something you're going to be on treatment for a long time. So they need to understand and be on the same page with their doctors so that it makes management easier. Then exercises, yes, it causes pain. Patient is in pain. So you wonder, okay, how would somebody in pain be doing exercises? But usually what we advise is to do pace yourself, you know, start if you know what you can do. Maybe even if you need to walk for an hour, and you'll know that working for that, you usually work for an hour and you're okay. But now because you have fibromyalgia, working for an hour is quite difficult for you. So you could take rest periods, work for some few minutes, take a break and continue. But exercises have been shown to help in the long run. So you do graded exercises that will strengthen the muscles. Even though initially when you start exercises, even for normal people, as in for people that don't have fibromyalgia, I mean, they
Mm-hmm.
they would, once you start an exercise program, you feel pain in the first few days. So
Mm.
imagine somebody that already has pain doing exercises. So but usually you'd advise that they do graded exercises, but that the exercises will help.
Mm.
Then there are some drugs that could also be used. Yeah. There are some drugs that could also be used, and usually the drug that works for one person may not work for the other person. So it's the treatment is actually individualized based on the symptoms the patient is presenting with.
Wow. Ijoma, have you been able to
Doc, can
cope or
I? Sorry, I
yes,
just
I was
wanted to
gonna come
ask.
to you. Yes.
Um,
Have you been able to, manage the disease as well? Living in this climate like Nigeria.
sorry, I just wanted to ask the doctor a question.
Okay.
Sure.
I it's said that fibromyalgia doesn't get worse. It's just the you started, but somehow I feel like mine has gotten progressively worse, even though my management of it, like I manage it better now than how I managed it from the beginning. But then I get new symptoms that stick around with the old symptoms that are there. So I wanted to ask, is it really, can we really say that it doesn't get worse?
Well, the truth is that fibromyalgia, the manifestation is different for different people. And there are times you could have worsening of your symptoms. It's called a flare. That's what we use to describe that. So some
Yeah.
patients would present with worsening of symptoms, maybe due to additional stress, or maybe something has changed in their lifestyle. So they could have worsening of their symptoms. And like I said, a drug that used to work before may not work over time.
Yeah,
So that's
that
why you
happens.
still, yes, that's why you actually still need to go back for your follow-ups, because if you're complaining to the doctor that this drug is no longer working, then other drugs could also be tried. Then you could also be taught, like you said, you've learned to cope with your symptoms. There's also what you call cognitive behavioral therapy. So the person is taught ways to cope with the pain, things to do to manage the pain. So it's like I said, management is different for different people. What works for one person may not work for the other. So it's something that if you're having new symptoms, then you need to go back to your doctors, and they need to know what drugs you were on before and what symptoms you're having currently, and things your drugs may be tweaked a bit to see, and other things added to see what can happen, like adding exercises, doing the acupuncture, doing all those tai chi exercises, muscle strengthening exercises. Those things have been shown to actually work as much as possible, especially when you combine them with the drug. Joma, do you understand what I'm saying? So
Thank
maybe
you.
we may need to talk
Yes,
more
thank
to
you.
understand what drugs
Yeah,
you're on
yeah,
and which
yes.
rheumatologist you're seeing. So we'll need to talk after the program. Let's see
No
how
wahala.
we
Thank
could
you
work
so
with that.
much.
Yeah,
I'm
I
really
appreciate
glad I facilitated this meeting. But before I let you guys go, Ijeoma, before I let you go and before I let Florentina go, let's talk a bit about, have you faced any, and I hate to be the one, I hate this word just because of how much of a bad rep it's gotten, but unfortunately it is true. With many things that are unknown or Nigerians don't know about, what associates that is stigma, stigmatization.
Yeah.
In your case, living with this disease, have you been stigmatized and have you been able to manage the disease in this climate?
Well, the thing about there is a certain way in which we perceive society or our around us, especially in
Mm,
Nigeria. We believe that, oh, if something is wrong, once we put attention on it, it will get better.
mm,
And then you now see someone who, no matter how many drugs you give her, no matter how many times she comes to the hospital, injections on injections, it doesn't get better. This person is not getting better. And you know that we kind of have that ideology that, oh, if bad things happen to you, is because you're a bad person. So
mm,
you have that kind of, I've also had, friends basically check out because, I mean, it can be a lot, and that's from the person who is going through it. So, for sometimes for people around you to see it, it's too much. It's a lot, you know, for somebody who is actually not in that situation. So for a lot of people, it's like, oh gosh, I don't want to have to deal with this, or I don't want to deal with this. And they would rather stay a bit farther away from you, and once in a while say, how now, how are you doing, and all of that, and then go
mm.
back to their normal lives.
Wow. Wow. But if, Dr. Florentina, before I let you go, as we're running out of time real quickly,
it. Okay.
when it comes to age, what age range, can this disease affect? Is it just anybody? Is it for old people, young people, middle-aged? What are the age bracket to
It
if
can
to be
actually
affected by this
affect
disease?
all ages, even
Wow.
children, but it's actually
Yeah.
more common in middle-aged people, people from 30 and above. But it could affect all ages, just that it's more commonly diagnosed around that age.
Wow.
And
Ladies,
and
thank you
like
so much for
like
yeah.
Ijoma said, most times what we don't know, we tend to target a spiritual attack. That's the truth
Mm,
about things in Nigeria.
mm,
So I'm sure Ijoma must have faced some of that, being told she's
And,
having a spiritual attack. So
mm,
oh
you see a
gosh,
lot of
there are
our
too many.
patients coming and they are telling you that they've been told it's a spiritual attack. Some of them would have even made
Mm.
sacrifices and all that
Ew.
before getting to us. So,
chai.
but it's important to know. I am really very happy about this radio show, and because
Thank you.
it's always good to create awareness about things people don't know about. And
Mm,
fibromyalgia, like I said, is something most people may be going through, but because of the stigma and because of not
Yeah.
knowing what it is, you see them taking drugs over and over and over. So it's important that you know that once you have pain and the pain is there for a long time, you should actually see a doctor and possibly a rheumatologist, because there are doctors that treat such. And even though the drugs are not, even though it's not curable, it's something that could be managed. You can cope with it with your drugs and other lifestyle modifications that you'll be taught. So I'm
mm.
really very appreciative because this is a way of creating awareness. So I must commend you.
Thank you so much, and thank you, ladies, for making out the time to do this evening. I understand that Dr. Florentina, you're just coming off a shift as well, and also Ijeoma is quite busy because I can see from my hands and all the pains. Congratulations to you guys, and very busy. So well done, guys, and thank you so much, Ijeoma. All the very best. More strength, and I know that. In due time, you shall be a millionaire, and your art shall see the entire world. Ladies, thank you so much. Join me next week for another edition on the Smooth Health on the Drive. My name is Judith TV. This is the Smooth Drive. It continues on the other side. Stay with us. Thank you, ladies.
All right.
Thank you.
Sorry, I don't mind you giving Ijeoma. I would want to talk to Ijeoma.